Sorry, we have one webinar glitch. Sorry. Chelsea, do you have screen share on so I can move the slides?
Yes, it looks like you do have control right now. There we go.
There we go. All right. So now that we've gotten through that, we've done our quick introductions. Now we'll jump in. What are we going to cover today? One is just an overview of where we're at. One is we'll do a quick summation of the public employment impact survey we did. And two is what's the rationale for why we're presenting today on keeping your workers and workplace safe. Secondly, we'll get into the legal framework. What are the relevant laws at issue when it comes to keeping workers in the workplace safe? Third, we'll cover what internal guidance you should be looking at, what you should be updating, what you should be communicating with employees. Four, we'll look at some more practical advice and legal advice on how to keep your workplace safe. Five, we'll cover if you have employees either with COVID-19 itself, all the way down to employees who are generally fearful of exposing themselves to COVID-19, how do you deal with that? And then a quick summation of what our recommendations and time permitting will allow for Q&As. So during this webinar, we will do our best. If you want to utilize the chat button, at least on my end, it's in the bottom center of the screen. So for the individual not presenting, Chelsea or I, we'll do our best to keep up. But for much like our last webinar, for those questions that we can't get to during the webinar, we will do a follow-up with either you individually, or we'll send out a group question and answer to address every single question that's asked during the webinar. So as a first quick overview, prior to the last webinar, we conducted what we call a rapid survey. So we can understand economically and operationally what are you as local governments doing and intend to do to address COVID-19. So though it's not a focal point for this webinar, we do want to just summarize quickly. So first in sum, what are you doing operationally? 85% of you have allowed for remote work. So we do continue to see that trend. Secondly, as we'll talk about on workplace conditions today, a lot of you have implemented staggered or flexible work schedules to minimize the number of employees on shifts. Three, though we don't have a majority, we're not there yet, but it could plausibly happen. About 40% of you have furloughed employees or intend to do it. Four is about a third of you have reduced total work hours for your employees in different employee groups. Five is only about a quarter of you have implemented a hiring freeze. However, I think that is the number we'll see exponentially increase. As for example, we saw the Star Tribune article today where a lot of you, especially with your seasonal, your temp, and your park and rep programming are probably going to impose some hiring freeze. And very few of you to this point have laid off employees. A lot of you are probably in the wait and see mode to see where does the economy go, where does the revenue go, especially with the state and with property taxes. So again, we're just not seeing that across the board. Then we look at changes to wage and benefits. Well over 2/3 of you have been very flexible in allowing paid leave for any voluntary absent from work without scouring, for example, your sick leave if they met the traditional standards. We'll talk about that today. And then for involuntary absences from work, such as a reduction of hours or furloughs, about half of you are still paying those employees who've done it. Now, we do expect that number to trend down. Three is paying employees without being required to use paid leave. About half of you are doing that as well. Four is about 40% of you establish a new COVID-19 leave time. Now, again, we think that is a number that will likely trend down for those who've imposed a cap on a new leave benefit and they reach that cap, which is going to happen with more frequency, that may trend down. And then for across the board for a reduction in hours or furloughs, none of you, at least per our survey, have prohibited the use of paid leave. So what you have tried to do is allow at least employees to get payment through paid leave. So that's going backwards. Now, what's more relevant to what we're talking about today and why the topic is timely? One is we have a stay-at-home order through Governor Tim Walz that will stay in effect through 11/59. For a lot of you, it impacted your non-critical sector workers. Secondly, we do have a group of what's loosely called Midwest governors have partnered up to determine a plan of how they intend to reopen the regional economy. Now, part of the rationale why that group got together, and especially impacts all of you in the workforce, is there is some concerns, as we'll talk about in the next slides, from that group of what President Trump is doing to reopen the economy on a much more ambitious plan. So bottom line, those governors are going to work together and determine their top priority. Secondary is the economy. Top is the health and safety of citizens and workers. And one thing they are focused on is making sure that they've sustained control of the rate of new infections. And secondly, that there's enhanced ability to test and trace people. And that's something we will cover today. In addition, on the safety and health front, Minnesota obviously is still continuing to see the uptick. We haven't flattened the curve yet, to use that buzzword. In Minnesota, we have a little over 2,000 cases, and recently the state has second highest number of fatalities reported in a single day. However, the number of hospitalizations has actually decreased in Minnesota. So maybe we are getting to the point of flattening the curve, but per the governor and Department of Health, we're not there yet. And one issue that all of us need to think about on, are we going to have a floodgate of workers who we find prudent to return to work and or are clamoring to come back even if we don't find it prudent? Harvard University's put out a often cited survey that talked about, the bottom line is this, that in order to safely reopen the economy, bring all workers back to the workforce, Harvard University says that the number of tests need to triple by mid-May from about 146,000 now to over 500,000. So that is one entity saying, hold your horses on reopening the economy. We need to triple number of people getting tested. So we've got the Midwest governors, we've got Harvard University. Now we get into what does the Trump administration, what are they saying about it? So again, President Trump has a plan to reopen the economy, as we'll work on getting to the next slide here. And he's called it opening up America again. Not that we've heard that term in the political realm. So the bottom line that was issued this week by President Trump, that bottom line, opening up America primarily from your end means getting more workers out in the workforce, more people spending money, more people utilizing their services. So they've laid out some benchmarks of how either states or counties or cities should determine how and when they should reopen. So epidemiologically, they're talking about one is before even that happens, even the Trump administration is saying that the number of cases of illnesses related to COVID-19 must trend downward for 2 weeks. The cases and prevalence of positive tests must also trend downwards, and local hospitals must have capacity. So even though they want to open up America again economically, they're still saying, let's look at that epidemiological data. In addition, the Office of Personnel Management, Office of Management Budget, who has oversight over the federal government workforce, has indicated that they are, quote, in that second sub-bullet, actively planning to ramp back up government operations to the maximum extent possible. So again, all this is solidifying why you all need to prepare for the reopening economy to make sure your workplace and workers are safe. Then, as part of our overview, we also have the federal level, then we have Governor Walz on the state level, is making plans on how and when to start lifting the stay-at-home order that again is in effect through May 4th. One, they want to increase testing. Two is there is some pledge to get a lot of workers back to work shortly. Roughly about 15% close of the workforce is unemployed, which is nearly 500,000 workers just in our state as of last week. And that we know that's gone up this week, so we could be pushing 20% of the workforce is unemployed. And then as part of Governor Walz's plan, he talks about critical businesses or workers need an individualized plan on how they intend to reopen. But before they do that, much like we're doing in this presentation, they want entities, businesses, cities, counties to make sure that they got appropriate safety measures in place. Now, yesterday, we had the Centers for Disease Control Director, Robert Redfield, state in an interview, not to be Debbie Downer on this situation, but we're preparing to get people back in the workforce on a short-term basis. But the bottom line is that we now have the federal government saying yesterday, look at the assault of the virus, coronavirus, next winter is actually going to be more difficult than what we are going through now and will continue to go through. And the reason is this, is that at the same time as coronavirus is still an epidemic, we're also going to have a potential flu epidemic, which of course in Minnesota is a big deal in the winter. So we feel this further solidifies why not only short-term should you plan on getting workers back, making sure your workplace and workers are safe, but this is your good opportunities. We'll go through the checklist, how long-term you should start to plan, especially for the winter, if we get epidemic number 2, which also can include a second epidemic, not just coronavirus still, but also the flu epidemic. So with that practical overview, we'll now turn it over to Chelsea to talk about what's some of the legal framework of what you need to consider in making your workplace safe and your workers safe. So Chelsea.
Thanks, Brandon. Yep, so as Brandon mentioned with going through our topics, so I will cover a little bit of the legal framework first. As with any legal issue, especially in the labor and employment realm, there are a lot of different guidance and different laws in play here. So first, we're gonna look at workplace conditions. So in total, some of this legal framework is really guidance from different organizations. So you can see we have it divided into workplace conditions framework built around that, and then followed by employee medical and leave laws. So with workplace conditions, you have the Minnesota Department of Labor and Industry guidance that's been issued, along with guidance from and laws in play from the Minnesota Occupational Safety and Health Administration, or OSHA. In addition to that, governor's executive orders, and then finally CDC guidance. So we'll go through some of that just as a preliminary overview, but a lot of this information will be worked into the bulk of the presentation, which is really looking at workplace conditions and the employee medical and leave laws that are also in place and should be considered when looking at what needs to be thought of and worked into your policies and procedures moving forward in light of all of this legal framework. So starting with workplace conditions, the Minnesota Department of Labor and Industry, so as an agency, it wears a lot of hats. It oversees occupational safety and health, or the Minnesota OSHA organization, wage and hour standards, and then workers' compensation. And so when looking at the guidance from the Department of Labor and Industry, so the guidance really incorporates a lot of other state and federal laws. It is helpful guidance. I think a lot of times it's focused more on information for employees and workers, and what information employees should have, as opposed to practical steps for employers, but they do issue some of that guidance as well. In addition, throughout the presentation, we'll be talking about OSHA. So employers that are under the jurisdiction of Minnesota OSHA have to comply with both federal OSHA standards, and then and because those have been adopted by the state, and then in addition, Minnesota does have some Minnesota specific regulation related to OSHA compliance. And as an organization, so MinOSHA compliance is the body that enforces those regulations. So that would be the body that's conducting worksite inspections, responding to employee complaints about an unsafe work environment, conducting accident investigations, and then providing educational and technical assistance. So just for a general overview, so Minnesota OSHA, there's a fundamental obligation for employers to protect employees from known hazards. So what is known as the general duty clause at the federal level, but it's substantially the same, is that employers are required to furnish employees with conditions of employment and a place of employment free from recognized hazards that are causing or likely to cause death or serious injury or harm to its employees. So with that, employers and employees both have to follow requirements under OSHA. There's separate subsets of what employers are required to do as opposed to employees. And with that, employers cannot retaliate against employees for reporting health and safety concerns at work. So again, a lot of this information will be built into what do you do if an employee is fearful, for example, of returning to work related to COVID-19 and handling employee concerns when knowing that the employer has an obligation under OSHA to provide the safe working environment, but how to do that in the best way possible. So one more point on OSHA. So many employers are required to develop and use a formal safety and health program. So the name of that is Workplace Accident Injury Reduction Program, or the AWARE program. So we will get into this a little more specifically. It likely applies to many entities that are tuning into the webinar. So again, just stay tuned for additional information on both the AWARE program, but then also safety guidelines in general. Guidance from the governor's executive order. So through the executive order, there's been a number of them. Having looked through most of them, there are specific executive orders that would apply to different industries and obviously give guidance on what the governor's doing related to specific industries. But in general, the one executive order, which was 20-33, states that employers really should be ensuring that critical sector workers and the workplace adhere to the extent possible the OSHA standards that we just covered, and then Minnesota Department of Health and CDC guidelines related to COVID-19. And of course, this includes adherence to social distancing or physical distancing and proper hygiene. In looking to CDC guidance, the CDC has put out a lot of guidance specific to industry, different positions. Listed as just an example of some of that guidance. So it's broad, but the interim guidance for businesses and employers, this covers a lot of different areas of guidance the CDC has put out in total, but there's also guidance that's specific to law enforcement personnel and what those individuals should know. And in addition, firefighters, EMS. Again, this is just a sample of some of that guidance that's provided, but by no means exclusive. So in a lot of ways, the CDC and OSHA are working together in issuing some of this guidance, and a lot of guidance from the CDC will incorporate necessarily what's required of employers under OSHA. So according to OSHA, most American workers will likely experience lower medium risk exposure levels, and we'll talk more about what that means when we get into workplace conditions. But regardless of the exposure risk level, all employers should really consider how they can best decrease the spread of COVID-19 through their workplace policies and procedures. And looking at what does that mean specifically. Again, I know a lot of people have heard this from, whether it's from the CDC or other presentations, but employers should actively encourage sick employees to stay and remain home, identify where and how workers might be exposed to COVID-19 at work, educate employees about how they can reduce the spread of COVID-19. And in order to maintain healthy business operations, it's recommended to identify someone as a workplace coordinator within your entity who will be responsible for all COVID-19 issues and their impact in addition to considering implementing flexible sick leave and supportive policies and practices. Some of that we discussed in our previous webinar. Assessing essential functions and considering establishing policies and practices for social distancing, which can include reiterating that employees still shouldn't be gathering in break rooms or around the water cooler. That's really all encompassing, but sometimes even with rules like that, there are tendencies for employees to still congregate in certain areas. So really making sure that that's being enforced and monitored. And then finally, maintaining a healthy work environment. So performing routine cleaning and disinfection. When you do have to attend meetings or gatherings, make sure that you're taking appropriate care. And then finally, supporting respiratory etiquette and hand hygiene for employees, customers, and worksite visitors. And the CDC has also issued guidance to individuals. So again, you have the CDC guidance geared more towards employers, but it's also important to remember that if you have employees who have questions, the CDC does have a lot of good information, and they are who you should be getting this information from that you can pass along, which includes what should employees do if they're sick. It goes through groups that are at a higher risk for severe illness. So, for example, older adults and those who have serious underlying health conditions are at a higher risk. So, guidance that is specific to those individuals and what precautions they should take. And then information on preventing getting sick. So, with the recommendation from the CDC that, especially in areas of significant community-based transmission, that people should be wearing cloth face coverings. A lot of questions have come from different entities about whether they should be requiring or implementing a policy related to face coverings or masks, and how that works with those other positions or job duties where they are generally required to have personal protective equipment. So we will get through all of that. And again, we're going to incorporate all of this into the second portion of the presentation. So if you do have questions specific to this guidance, it may be covered later on, but again, we will do our best to follow up with any other questions. So getting to employee medical and leave laws. So first, to touch on the Americans with Disabilities Act, this really is another example of federal law that's going to be incorporated into what do you do if employees, for example, have underlying health conditions. But again, just as a basic overview, the EEOC enforces anti-discrimination laws, including the ADA and the Rehabilitation Act. So there is a requirement under the ADA for reasonable accommodation and not to discriminate based on disability, rules about employer medical examinations and inquiries. So this is how this all fits into the context here and responding to issues related to COVID-19. And a lot of this guidance is based in part on, so the EEOC had published a pandemic preparedness in the workplace document that was initially published during the H1N1 outbreak, but they have since gone back and have updated specific examples, mostly related to the ADA, but those specific examples are highlighted in bold and mention where this is specific to COVID-19. So another example of a resource that will be incorporated throughout our recommendations. And then quickly, just to touch on the Minnesota Human Rights Act. So generally, you could think of it as some of the equivalent of the Title VII at the federal level, but the Minnesota Human Rights Act protects employees from discrimination on the basis of disability, race, national origin, age, and other protected classes. So it is another legal piece to keep in mind when handling employee medical related issues, this and the ADA, as individuals with disabilities, if their underlying condition especially is considered a disability under the ADA or the Minnesota Human Rights Act, that those individuals may have a right to request reasonable accommodations. Moving on to workers' compensation. So one area that has changed recently is workers' compensation related to presumptions for police officers, firefighters, generally first responders. So employees who contracted disease arising out of their employment may be entitled to workers' compensation benefits. And under the new legislation, if an employee has contracted COVID-19 and they're employed in those first responder positions I mentioned and listed on the slide, those individuals, the illness, if they contract COVID-19, is presumed to be a workers' compensation occupational disease, compensable unless the employer is able to disprove the presumption. So one note for entities that may be relevant is that generally speaking, firefighters and emergency response volunteers are considered employees for purposes of workers' compensation. And those, one other thing to keep in mind is that this doesn't at this time cover exposure or those employees who are not ill. Employees don't necessarily need to be tested positive, but it still would only apply if the employee is ill or has contracted COVID-19 or has been presumed to be. And one other piece to keep in mind when thinking of how all this guidance plays into workers' compensation and what safety considerations need to be kept in mind. And a few notes on leaves. We did cover leaves extensively when going through our previous webinar, but the emergency paid sick leave is of course relevant and should be considered as to whether an employee may qualify for emergency paid sick leave, because that may entitle the employee to take up to 80 hours of emergency paid sick leave where they could be compensated at the regular rate if they're unable to work for the reasons listed, such as quarantine pursuant to federal, state, local government order, or quarantine pursuant to healthcare provider advisement, or the employee themselves is experiencing COVID-19 symptoms and seeking a diagnosis. And employees otherwise might be able to take this leave and be compensated at 2/3 of their regular rate as opposed to regular if they're unable to work because they are either caring for an individual who's quarantined or caring for a minor child or experiencing a substantially similar condition. So generally speaking, the first category of regular rate that you see is related to if employee themselves is experiencing quarantine or symptoms as opposed to caring for an individual with COVID-19. In addition to the EPSL, also under the Families First Coronavirus Response Act, the Emergency Family Medical Leave. So this expanded version of FMLA entitles employees who qualify for 12 weeks of EFML that they may be able to be compensated at 2/3 of the regular rate after the first 2 weeks of EFML that may be unpaid. And that would be for purposes of caring for a minor child whose care provider or their school is unavailable due to COVID-19, and for that reason, they're unable to work. Just a note, this is, of course, separate from FMLA, for which an employee may qualify if they have their own serious health condition or the health condition of an immediate family member. So the EFML expands FMLA for that school closure, childcare provider closure reason, but FMLA is still in play in considering all of this information. Additionally, care of relatives. So under Minnesota law, employees are entitled to use any sick leave benefits they might have. Generally speaking, to sum it up, any sick leave benefits that an employee has in the state, whether that's through employer policy or if it's the city has a required amount of paid sick leave that has to be provided, employees can use those sick leave benefits for those individuals listed. So child, spouse, parent, grandparent, step parent, on the same conditions that they would be able to use that leave for their own injury or illness. And there are limitations on that are listed, including that leave can be limited if it's not for a child. So if it applies to any of the other individuals listed as relatives, it can be limited to no less than 160 hours in any 12-month period. And finally, under state health law, there is a provision related to isolation and quarantine of persons. So employers cannot discharge, discipline, or penalize an employee for missing work if it's due to a recommendation from the Minnesota Department of Health that employee isolate or quarantine. So this applies to the individual themselves, and also if that individual needs to care for a minor or adult family member, if the Department of Health has recommended isolation or quarantine for those individuals. And this employment protection is available for 21 work days. So that in mind, so all of those leave, whether it's provided under federal law, state law, should be kept in mind in addition to any other leave that might be provided under employer policies. So keeping that in mind, we're going to head to internal guidance. So I mentioned we'd come back to the AWARE program. So generally speaking, and again, this is going to depend on how many employees an employer has or what industry they work in, but just as threshold component, if you are an employer who has more than 25 employees, or you're an employer who may have less than 25 employees, but you have a high lost workday incident rate, those employers are required to establish and administer a joint labor management, safety, and health committee. So specific tasks that are required of someone on that committee, and what the committee is required to do includes conducting job hazard analysis, developing and maintaining safety policies, and providing for employee safety education. Separate but related, so back to the AWARE program. So employers who are engaged in specific industries based on the North American Industrial Classification System codes, so that will determine whether an employer is required to have this program or the AWARE program in place. And for a little bit more information on AWARE before we move on. So if you are a covered employer who has to establish such a program, what this includes is it has to be a written program that discusses how managers, supervisors, and employees are responsible for implementing the program, how it's going to be measured and maintained, what methods will be used to look at, analyze, and control new or existing hazards, conditions, and operations, how that program will be communicated to employees so that they're aware of workplace hazards and controls, because of course having a program doesn't have much utility if it's not communicated and implemented properly. In addition, how workplace accidents will be investigated and corrective action implemented, and then finally how safe work practices and rules will be enforced. So under the same statute that requires covered employers to establish this program, employers do have to review their workplace accident and injury reduction program policy annually and document how those procedures are included in the program and being met. There's some leeway provided, but generally speaking, the written programs under AWARE, and there are a lot of examples of such policies. They are a good general, if you want to use it as guidance, even if you, as an employer, you are not a covered employer required to have an AWARE policy. These are generally good safety guidelines to use as a starting point for developing or revamping a safety manual. Of course, a lot of AWARE policies or programs are specific to the industry, so there may need to be specific adjustments made, but it is a good starting point. And then looking more to procedures, practices, and guidelines. So employers may have specific department policies. So for example, if the fire department has their own standard operating procedures and guidelines, that department may have their safety procedures well established, and taking that into consideration, employers should still ensure that employees are being classified properly. And we'll go through the exposure risk and what that means, but based on that those departments are taking appropriate precautionary measures. And further, that employees are still and continue to be receiving safety training. So as I mentioned with fire departments and law enforcement, a lot of OSHA standards, such as standards related to personal protective equipment and respirators, those standards do include explicit safety and training requirements. So where those exist, those specific training requirements should of course be followed. But otherwise making sure that there is a good general safety training program in place for employees, and that is updated and reviewed regularly. And then finally, as I mentioned, with personnel policies, so even if you have departments with specific policies, generally speaking, a lot of entities have a general policy related to employee health and safety. And I mentioned this just to keep in mind that if, as an entity, you are going to develop a new policy or implement a policy related to face coverings, for example, for employees coming back to work, whether it's required or voluntary, you should keep in mind that if you have departments with their own policies related to masks, because those job duties are different and require additional considerations, you should make sure to include in your policies that specific departments have a superseding policy, and make sure that's all being accounted for when implementing new policies, just to lessen any potential confusion employees may have. Okay, and moving on to workplace conditions. So I mentioned the hazard assessment. So OSHA does have a comprehensive set of guidelines for assessing hazards, job hazards on just a very broad basis. And of course, this is geared specific to hazard assessment related to COVID-19. So worker risk of exposure to COVID-19 will depend on a number of factors. So, and depending on the level of risk for employees, that will determine what protections and practices should be implemented. So, I mean, as you can see from the triangle, it's not complicated, but job tasks have been divided into 4 risk exposure levels, and those risk exposure levels from very high risk down to lower risk, those will determine what OSHA has said needs to be considered related to protections and practices to implement. So looking at the diagram, most workers generally fall into lower or medium exposure risk levels, but that is subject to change depending on what duties on a day-to-day basis. For example, a law enforcement officer might be, performing medium to high risk per the OSHA guidance, but there are circumstances in which they may be at more of a high risk rather than medium to low risk. So again, this is going to depend, and I will touch on that a little bit further in just a moment. So again, lower exposure risk. These are jobs that generally don't require contact with people who are known to be or are suspected of having COVID-19. So these employees would have minimal occupational contact with members of the public or other coworkers. Anyone working remotely, of course, is going to have lower exposure risk. This would include healthcare workers providing only telemedicine services, and those workers who don't have frequent close contact or prolonged contact within 6 feet with coworkers, customers, or the public. Moving to a step higher, the medium exposure risk. So these would be jobs that require frequent or close contact with people who may be infected but are not known to have or are suspected of having COVID-19. So again, most workers will fall into either the low or medium exposure risk. Moving to high exposure risk, this would include jobs that have a high potential for exposure to known or suspected sources of COVID-19, including healthcare delivery and support staff, those staff who must enter patients' rooms exposed to known or suspected COVID-19 patients, in addition to medical transport workers and mortuary workers. And this all involves individuals working with someone who is known to have or suspected of having COVID-19. Then finally, moving to the very high exposure risk. So a number of these jobs are similar to the high exposure risk, but these individuals will be performing job duties where they're working with known or suspected sources of COVID-19, but they're also performing procedures where they are then moved from a high risk to a very high risk. So generally this is being referenced as aerosol generating procedures, whether that's intubating or performing cough tests. This would all generally be referenced as an aerosol generating procedure. So in these instances, an individual would be at a very high exposure risk or categorized as that. So under OSHA, employers are required to assess occupational hazards, and based on that, some OSHA standards, such as those for personal protective equipment and respiratory protection, those are recommended depending on what level of risk. So touching more on that in just a moment, employers should consider if and when their workers may encounter someone infected with COVID-19 in the course of their duties, or when workers could be exposed to environments or materials contaminated with the virus. So generally, this is what the hazard assessment consists of. And I will provide specific example for wastewater management and first responders and law enforcement just as examples. But again, a lot of this generally can be applied to workers in the critical sector. One additional thing to keep in mind under OSHA is that employers are required to provide employees who are routinely exposed to an infectious agent with infectious agent training. So if you look at the Minnesota Administrative Rules, it does list a lot of different hazardous substances and viral agents, all under infectious agents. So coronavirus being one of those, this is something that if someone is in the course of their work routinely exposed to in infectious agents such as coronavirus, that is something that they would need to receive infectious training or any of the other infectious agents. So this type of training generally should occur before someone is assigned to a workplace where they are routinely exposed, or if their job duties change, then they will now be in a position where they're going to be routinely exposed. That's the time when they should be receiving that training. And then following from that, employees should be getting updates at least annually on that training as well. To add a few specific examples, so we did draw on some of the experience and knowledge from the attorneys in our office who work for, and generally they work in the areas of environmental law and other regulatory issues. So because a lot of the guidance that I have seen so far from the CDC relates specifically to healthcare workers, first responders, there is a lot of guidance specific to those positions, but I personally had not seen anything related to wastewater management. So knowing that a lot of entities do have employees in these positions, something to keep in mind is that coronaviruses may be present in raw wastewater. So generally, water treatment methods that use filtration and disinfection should inactivate COVID-19. However, if water treatment is insufficient to remove or inactivate coronaviruses, viruses may be released into the environment. So generally, here are some best practices listed at the bottom of the slide for protecting those workers who are working in the sanitation treatment facilities. And those best practices include wearing personal protective equipment, including gloves, boots, goggles, and face shield or mask, performing hand hygiene frequently, and avoid touching eyes, nose, mouth with unwashed hands. So hand hygiene and avoiding touching eyes, nose, mouth, those are general guidelines from the CDC for any worker, any individual, but again, there is this elevated risk for wastewater employees who should be wearing appropriate personal protective equipment as well. Again, touching on those best practices, so these should be implemented so that employees are encouraged to keep up with hand washing, eating separately from the work area to reduce potential transmission, and any of the communications related to sanitation practices, whether that's establishing new practices or revising them, all those communications should be sent to plant operators and staff to inform them of these practices. Related specifically to first responders and law enforcement, as I mentioned, a lot of guidance specific to these positions has been issued from the CDC, and there's a lot of good information, but just to distill that for you, law enforcement currently, those individuals who must make contact with individuals confirmed or suspected to have COVID-19 should be following the CDC's interim guidance for EMS. So law enforcement, there are certain day-to-day duties where they may not be making contact with individuals in this way. So obviously then thinking back to the hazard assessment, they would be lower when performing those job duties, but anytime they are making contact with confirmed or suspected individuals having COVID-19, this guidance should be referenced, which includes only trained personnel should be wearing only trained personnel that is wearing appropriate personal protective equipment should be having contact with individuals who have or may have COVID-19. And what that is may depend on what duties are being performed, but generally the minimum PPE recommended is a single pair of disposable examination gloves, disposable gown or single-use disposable coveralls, and then any mask that's been approved by NIOSH, so through the Occupational Safety and Health at the national level, and that should be an approved particulate respirator, so an N95 or higher level respirator, although given the shortage of N95 or higher level respirators, the guidance has been issued stating that face masks are an acceptable alternative until the supply chain is restored, and OSHA has also released guidance stating that they're relaxing enforcement related to that. So if you're not able to obtain N95 or higher level respirators, you can keep in mind that is enforcement on that is being relaxed, but employers should be doing what they can, making best efforts to comply with guidance from OSHA, which may incorporate guidance from the CDC as well. Moving to related to personal protective equipment, but as I mentioned, the CDC had their general recommendation that members of the public wear on a voluntary basis cloth face coverings in public settings. And so related to that, we've recommended that employers do consider implementing a notice to employees related to facial coverings, masks. Employers can require employees to wear protective gear such as a mask or gloves, but should consider making this voluntary for lower exposure risk positions. So employers that are requiring employees wear masks are also responsible for identifying, providing, and paying for masks or other PPE. This has been made clear as it relates to the personal protective equipment, for example, for law enforcement that is regulated, such as respirators and other items. It's not entirely clear how this would relate to if employers are requiring facial coverings, but it likely also includes this if it's being used as personal protective equipment. But again, because it's not, those facial cloth coverings aren't, there's a little bit of a gray area between what's required. It's clear in certain circumstances when employers are required to pay for that, identify, provide, and pay for that, but it's less clear when, it is less clear when that is related to cloth face coverings for those positions that are medium to low risk, where OSHA generally isn't requiring that, but saying that it should be considered on a voluntary basis. And another reason why we've recommended that, except for those high-risk positions, that employers consider making policies voluntary, is because employers might not be able to supply masks long-term, especially if you're incorporating specific types of masks into a policy. Something to keep in mind is that those masks just might not be available even if you have them now. If people are taking care of them properly and not reusing them, if you run out, then of course you have a policy that has less utility at that point. Employers should also keep in mind that, again, there are reasonable accommodation requirements under the ADA. So if, as the employer, you have an employee with a disability that relates to, if they're being generally required to wear personal protective equipment, but they need a reasonable accommodation related to that, such as non-latex gloves or face masks, this should be considered as well. It should work with the employee using the general process, and Brandon will touch on that more in just a moment. I think getting to distancing. So physical distancing or generally has been referenced as social distancing. The CDC has stated it's critical to emphasize maintaining 6 feet physical distancing in order to slow the spread of the virus. So again, making sure that you're emphasizing this and making sure that employees are abiding by this in all areas of the workplace, which might mean that break rooms are generally closed and are at least enforcing people not hanging around in them as they usually would. Staggered schedules. So staggered schedules are an example of what OSHA would consider as an administrative control, but it would involve adjusting work schedules so there's fewer people at the work site, and we've seen a lot of entities doing this, but generally with the goal being to limit interactions in the workplace and assist with physical distancing. Additionally, implementing flexible work sites or telework, increasing physical space between employees and customers. A lot of people have seen the partitions put up at grocery stores, for example. This is an example of what OSHA would consider as a engineering type of a control. So you're building physical barrier between employees and customers, something to consider in addition to usual physical or social distancing. Finally, implementing flexible meeting travel options. So if there are meetings that are considered non-essential, potentially postponing those and holding other meetings remotely if possible. And then finally, in circumstances where it's necessary to downsize operations, there might be facility shutdowns as well, depending on whether it's a critical sector or not. It can also play into distancing and everything that should be considered related to CDC guidance in general. Looking at sanitary conditions, this relates back to the general duty that employers should be providing a workplace for employees that are free from recognized hazards. So generally employers should be cleaning and disinfecting, but should be doing that wearing gloves, making sure that you're cleaning frequently touched surfaces, and that if there are employees who are generally use shared work sites, for example, that you limit that as much as possible, but still practice cleaning all of those surfaces. Employers should close off areas that have been used by an individual who is sick, and should open doors and windows to increase air circulation if that is the case. Based on CDC guidance, they have recommended that employers wait 24 hours if possible. I understand there's a lot of circumstances where that's not possible, but again, if possible, that employers wait 24 hours before cleaning or disinfecting. And then finally, washing hands often while cleaning for at least 20 seconds. To assist with hand hygiene, employers should also provide disposable wipes so that commonly used surfaces can be wiped down by employees after each use. So to facilitate that practice, and also consider using EPA approved products for cleaning these surfaces and making sure that they're appropriate for the surface. Some additional considerations related to sanitation and hygiene. Employers should be providing tissues, no-touch disposable receptacles, providing soap and water in the workplace if possible, and otherwise providing hand sanitizer that's at least 60% alcohol. Placing hand sanitizer in multiple locations to encourage hand hygiene. If it's there, just sitting on the counter, a lot of employees will use it. Placing posters that encourage hand hygiene both at the entrance of your workplace so that people keep that in mind right as they get in the door, and then also in other workplace areas where it's likely to be seen. And also employers should be discouraging handshaking and encouraging other non-contact methods of greeting, whether that's an elbow bump, what have you, just discouraging handshaking in general. Finally, with reporting to work, so under OSHA, employees can refuse to work if they reasonably believe they are in imminent danger under OSHA. So that does involve a reasonable belief that there is a threat of death or serious physical harm that's likely to occur immediately or within a short period of time. That could be your belief that the employee has been assigned to work in an unsafe or unhelpful manner with an infectious agent such as coronavirus. But that fear does need to be based on fact and not just a generalized fear of contracting COVID-19. So it's just something to keep in mind with why it is important to enforce all of the sanitation practices and everything else. But from there, we're going to move into the employee medical related issues, and I will turn it over to Brandon to discuss that portion through the end of the presentation.
All right, thank you, Chelsea. So in the hierarchy, what we're going to look at is, we've talked about workplace, now we're going to talk about your workers. And what we're going to go in descending order. First, we're going to look at if you have an employee that is tested positive for COVID, all the way down to what if you have an employee who just has some generalized fear of going to work due to COVID-19. So first, if you get somebody who does test positive for COVID-19, and we'll wait just a moment to get my computer moving here. So first, what if you got somebody you know, regardless of your source, that tested positive? What do you do? First of all, obviously, step one, get them out of the workplace. And two is you can prohibit them from working. Again, we always get the question, can we tell them to quarantine? Can we tell them to do certain things at home? Generally, you can encourage things, but as an employer, you can say you can't work, and the length of time you can't work for is as required by a healthcare provider and CDC guidance. Currently, CDC guidance is in the 14-day mode, and you can look up all the details depending on when someone got their symptoms or what symptoms they had and when they tested positive. But bottom line, you want to say, look, until the healthcare provider says you're cleared, you can't come to work. Then step two is after you've got them out of the workplace and isolated, you also ask that employee which coworkers have you come into close contact with, and that's in the previous 2-week time frame, because that's when they could have been asymptomatic and or symptomatic, but still were a carrier of the virus. It could have exposed others. In addition, not only do you ask them who you come into close contact with, which is though anybody in the workplace who you come within 6 feet for a prolonged period of time, what shared work areas have you used? For example, are you using at the wastewater treatment plant a shared desk, even if you weren't in 6 feet proximity with anyone for the last 2 weeks? You also need to know that so we can identify what employees are at issue. So that's what you do with the individual employee. Now, how do you handle it with other employees? So step three, you contact the employees identified by that employee, inform them that an employee without using your name. Now we get the practical reality. A lot of you are either smaller entities or you're larger entities and you have small departments, divisions, and they're all generally probably going to know who's got COVID. But you as an employer, even if the world knows about it, you can't directly acknowledge who that employee is. So instead, you're relying on what the employee told you and said, look we have an employee who's at the work site you're at, and or we know they've been in close contact with you. You can inform and should inform those employees that an individual's tested positive for COVID and they identified you. So again, to facilitate physical distancing, your contact may want to be by telephone, if possible, with those employees, especially when you know they've been in a known exposure. So you also always have to be thinking on the micro level, how's it best and safe to communicate with those employees? Again, do your best to not disclose the identity. You never should directly name that person, and do your best to the extent practicable not to share the position title or even the department. But on the other hand, some employees who have tested positive or been exposed, we have been successful on rare occasion to have that employee who we've had at home give valid written informed consent under the Minnesota Government Data Practices Act to share their name in the workplace. Because we all know it's a lot more practical and prudent in talking with others to avoid a scare tactic and a whodunit or rumor mill to say, well, it was Joe Smith or Susie Jones who had it. But the only time you can, again, share their names or, again, further to protect their identity, position title, or maybe even department or division is get that valid written informed consent. Employees are probably going to be more likely, though it can be stigmatizing to them, to share it, knowing it's for the benefit of the workplace and the public if you can get their name shared. So then 4 is, for those employees who we know have been exposed in close contact or shared the same work area with that employee, you can request that they self-quarantine, or more specifically from the employment end, you can request that they stay at home for, again, CDC guidance sometimes shuffles, but generally right now, as we put in there, you should have those who've been exposed, again, close contact or shared workspace, have them stay at home for 14 days. Let's put aside the paid leave part and how we classify their absence, but bottom line, that's what you should do and you can do from an employment perspective with those that have been exposed. So that's step 4. Then we get to step 5. Anywhere you know that employee who's been infected has been, you should thoroughly clean and disinfect. And again, follow the standards that Chelsea laid out in her workplace condition guidance. And I know we loosely say you as employers, but we all know key people in this are not just the frontline people or your managers, but your maintenance and custodial staff. They're the ones in the hierarchy who should have well familiarity with how do you clean and disinfect and when you do it and where you should do it. So again, actively engage your maintenance and custodial staff. And bottom line is you should thoroughly infect within 48 hours. So don't let time lapse too far. You've got to get moving quickly on cleaning and disinfecting the work site. Then step 6, how do you do macro communication? You know, we've talked about for those employees who the employee infected said the employees XYZ have been potentially exposed, but you should put some on notice to the extent you think practical on others who may have had some contact or have been in the same work site, even if they don't work with them on a day-to-day basis or share a direct workspace. We generally advise, and so does CDC, put out some broad communication to other employees who may need to know about it, which for smaller entities or smaller departments, maybe it's fair to say everyone in the department or your entity. So what are you saying that? If someone's tested positive, don't name them. The employee's self-quarantining. All close contacts have been notified, so you don't get individuals paranoid. Well, who is it? How do I know I haven't been exposed? But generally with your micro employment tracing, you've identified who's been exposed, hopefully. And then you state if someone's been exposed, you also mention that the individual employees exposed by that employee at work are also at home quarantining at well. And of course, keep up the line of contact with HR, department heads, or use administrators, managers. So that's step 6. Bottom line, when you get someone who's positively identified as having COVID. And also, you want to notify employees, what are you doing? Are you closing that work site for disinfectant in the meantime? Sometimes you may not need to do that. You can just disinfect and return people. But again, follow some of Chelsea's advice from earlier. Then 8, bottom line, when it comes to either the infected employee or those who've been exposed, all this is liberally construed under the American Disabilities Act as medical documentation on all those employees. So under the ADA and consistent with our Government Data Practices Act and record retention schedule, you should retain all of this individualized employee data in a confidential medical file that's separate from their personnel file. So that's, you know, basic ADA law, but that's how it applies in the COVID world. So now related to potential exposures in the workplace, either individuals at the front line like public safety were exposed to someone in the public who had COVID, or the example we had, you have an employee who's potentially exposed other employees to COVID. You do have to record this under federal regulations consistent with enforcement guidance put up by OSHA. So it itemizes specifically what information you are going to have to record. We already recommended you should, but there's some more details related to that on how you should record potential exposure in the workplace. So we've laid out the details in that slide. Now related to, again, an individual who actually has COVID-19, we have to shift gears. There's some reasonable debate, but generally you may have to consider, well, they have COVID, which means they have some medical issue. That medical issue could have long-term impacts. Therefore, they may have a qualifying disability under the Americans with Disability Act. So generally, because of the legal la land, we at least say you should engage in an interactive process with the employee who tested positive, not yet anybody who's been exposed until they start to have symptoms or test positive themselves. You should work with them. One is, we've told you they're absent from work, but let's work with them. Are we going to provide paid leave to you? Are we going to make it unpaid if you've exhausted paid? Or eventually, when you're not going to be no longer absent from work and are cleared by your healthcare provider to come back, are we going to have a more flexible workplace schedule to ease you back in the workplace if you still have impacts? How are we going to reduce contacts with others? Do you need special equipment? So you all have to put that ADA hat on when you have an individual who's tested positive for COVID and come up, how can we reasonably accommodate that person? Now, some things are mandated like leaves. Now, so we've already talked about either you proactively are going to reasonably accommodate them or engage in the interactive process, or the employee may ask for it. So bottom line is, in order to make an effective opinion on how you should potentially accommodate someone who tested positive, you should engage in that interactive process and then do the appropriate, as we'll talk about later with some forewarning, how do you appropriately ask them to get sufficient medical information? So on one hand, we talked about employees tested positive. Now in the descending order, what about employees who haven't tested positive, have no known exposure yet, yet we deem them high risk. So what do we mean by high risk employees? That's either individuals based on age, which won't be as prevalent for all of you as employers, but those with serious underlying health conditions. And again, it's only if you know about the serious underlying health condition, which again, you'd only generally know through the employee themselves, that those are going to be the high risk employees. Put aside the issue we talked about earlier. By high risk, we don't mean going back to the hazard assessment Chelsea talked about. We're not talking about work functions here in high risk. That's different hazard assessment. This is just generally high risk employees based on their individualized underlying health condition. And again, bottom line is there's some good guidance on that from the CDC's website, groups at high risk for severe illness. So what do we do with those individuals who are generally high risk? One is, do your general ho-hum, keep the workplace safe through sanitation measures, through distancing, personal protective equipment. However, if a high-risk employee initiates the discussion, you should engage in a process with them to talk about if they have genuine concerns about COVID and they're high risk. You may want to allow some more liberality while COVID-19 is more widespread, even if not in your work site. So even if no one in your work site has it, or you don't know of known exposure in the work site, maybe in the interim, we at least want to engage with a high-risk individual who comes to us and talk about what measures can we take, either a leave of absence, or are all these measures we put in this slide sufficient enough? We're requiring symptomatic employees to stay home. You should stay 6 feet away. We're telling everybody else to do that. We're requiring frequent hand washing. We'll allow you to wear a face mask, or we may require it for certain individuals. So again, it's a balance. Do you keep them at work, or do you allow for a leave? So now we've got someone with a positive identification, someone with high risk. What about someone who's been exposed? And I put inside exposure in the workplace, and this not only applies to someone exposed in the workplace, but this next category of employees is someone who we know either through close contact in the community, such as we had one example in one city where the individual employee had close exposure with the local lender in town, local banker, and they spent numerous minutes and shared pens and paperwork with the local banker who was identified as having a positive COVID-19 case. Or we know about a family member of an employee. What should we do with that employee? Again, your default in this new world is basing it on CDC guidance. So the bottom line today is that CDC says, if you have an employee who you've known has been exposed to someone with COVID-19, had close contact with them, which also includes all family members who tested positive, you should require them to also stay home for 14 days after they last exposed to it. So we got the employees with COVID at home for 14, and those exposed at the work site or even not at the work site. At this point in time, the law is giving you wiggle room, and you can and should have that employee stay at home for 14 days and not come to work during that time frame. So then we get to the issues. What do you do if you have employees with generalized symptoms, but we don't know if it's COVID-19 based? First, you should get more proactive, not only in light of COVID, but in light of the imminent flu season coming up in the fall and winter, that one, you should always encourage employees with symptoms of cough, of sickness, of shortness of breath. You should always have encouragement that those people should stay home. But what if you have somebody either not at work or at work, and you know, and you have a reasonable belief based on objective evidence they have symptoms? So once that's triggered, that reasonable belief based on objective evidence under the Americans with Disability Act, you can, and even in light of EEOC, Equal Employment Opportunity Commission guidance, you should ask them what their symptoms are. And even if you don't know, but someone calls in sick, you should ask them if they're experiencing COVID-19 symptoms so that we can take proactive measures potentially with their coworkers to if we're concerned about potential exposure in the workplace. Now, in addition, we know this is happening in certain micro sectors of our public workplace. You can take employee temperatures. Now, we're not hearing about that much. There's practical problems with that, legal problems, but CDC and OSHA are giving some more leeway for employers to take temperatures. It's either if you're in a critical service sector, a frontline high risk sector, or you have symptoms, we can take temperatures. Again, we're not seeing a high prevalence of that, but that is something all of you in the future can be cognizant. Now, what are the two obstacles we have in Minnesota that are not as prevalent elsewhere? One is no matter what, there is no pandemic exception to these next two laws. The bottom line is this, is if you're going to ask employees about their symptoms, whether or not they have COVID, whether or not they have someone at home, you know, if they just don't bring it to you, even though you should always encourage that in writing, if you're going to proactively ask them more questions about their symptoms, about their exposure, about a COVID-19 test, one is you have to give them a tennyson warning. So you should set that up in autopilot under the Minnesota Government Data Practices Act. Utilize tennysons, or we have our canned fitness for duty ones. You always generally, unfortunately, before you start probing on details, give employee the tennyson warning. Now, there is case law that gives an outlet that says generally, if you're asking about a workplace incident, you don't have to give a tennyson. We're a little conservative. We think this is different. The bottom line, if you start doing more probing on someone's medical related data, you should give a tennyson. And secondly, under Minnesota law, and there is no exception yet, though we hope case law can evolve, the bottom line is this, is generally you can't force employees to give you anything medical. Generally, they don't have to tell you about a COVID-19 positive test result. Generally, they don't have to tell you more details about their symptoms. Generally, they don't have to tell you how long they're going to be out of the workplace unless they consent. Now, we can encourage, we can be strong in asking for it. And what you can't do, though, is say, if you don't give us this information, you could be subject to discharge. However, if you have reasonable belief based on objective evidence, someone has symptoms or they've got COVID, you can generally likely tell them, look, if you're not going to give us the medical info, because no matter what, we can't force you to give it to us, we're going to have you, as a precaution, again, stay at home for the 14 quarantine day period. One question popped up, can we give a tennyson warning verbal? Yes. So it is not required under Minnesota law to give it in writing. Generally, we say that's always safest, so we know you gave it and we know what you said. Have your can forms ready as administration to liberally hand out the tennyson to all individuals who may ask questions about individuals' symptoms or medical conditions. So it can be verbal, but again, we generally recommend the written can form to provide. And then bottom line is, you still have to, related to individuals who have symptoms, is one, you should have them stay home, and two is, again, retain their data in a separate confidential medical file. Now, something we're hearing a lot more about in this fifth category of employees, what if the individual hasn't tested positive, they haven't been exposed, they don't have sick symptoms, they're not high risk? This fifth category is generally, I have fear of being in the workplace because of potential exposure to COVID-19. On one hand, this is the scenario where you have a legal right to say, you have to show up to work, or no, we'll give you flexibility, allow you to use leave. So generally, there is no legal tying of hands with a generalized fear. However, we do generally recommend you vet with somebody why they have that fear in the workplace. Two is you should hopefully be taking proactive measures to mitigate their fear with all your safe sanitary work conditions. On the other hand, if they have that generalized fear and Minnesota's curve hasn't flattened yet, you can allow them, as we've recommended and a lot of you are doing, maybe you are going to be a little more liberal and flexible in allowing use of leave, or you have separate COVID-19 leave banks, and allow them to use their other leave banks that you otherwise wouldn't based on a generalized fear. Now, eventually, this likely can't go on for months because of a generalized fear of an employee, they're not going to be at work for 6 months. We all know long-term that's not going to work, and you can and probably should force that person to return to work without any of these other factors prevalent we talked about. But in the short term, maybe we're more flexible with leaves. On the other hand, especially with your frontline first responders, there's always exceptions to all these laws that generally you need to provide public safety, police, fire, for some of you, ambulance. So you can force those people. But again, bottom line, let's make sure they're safe and secure in the workplace with all those workplace safety measures we talked about. So this is one we're hearing a lot about. But again, this is where you have more legal flexibility to do as you wish. Now let's talk quickly about the leaves that are in your toolkit. One is required, as we've talked about, emergency paid sick leave. Bottom line, employees get paid their regular rate for 2/3. They get full 80 hours for their full rate if they're seeking a medical diagnosis or quarantined pursuant to health provider advisement. All that's related to COVID. So if we're looking at, these are all the leave, again, leaves in our toolbox we can utilize. You can also look at, for any of the categories of employees we talked about, you can also look at Family Medical Leave Act for their own specific condition. You also have, some of you have COVID-19 leave. Many of you have paid time off or sick leave. Many of you have vacation. Now, whatever you do, we recommend certain leaves that are paid versus unpaid run concurrently. What's the usual example? If you have unpaid FMLA leave, which generally it is for your own condition, concurrently require them utilize the use of paid leave, which could be the emergency paid sick leave as required by law or other paid leaves you have. So those are some of the tools. In addition, the federal government, especially with emergency paid sick leave, though we think you should require this for all other forms of leaves and all other categories we're talking about, the employee should provide you with some signed statement with their name, date when they asked for the leave, especially if it's related to EPSL, what's the qualifying reason for it, and a statement that they can't telework. Because again, in addition to leave, we should also be looking at, can we have that person telework from home if either they can't work or have a generalized fear? Let's do our best if they're ready, willing, and able to promote telework just beyond leave. So again, that's this slide. What guidelines, as we talked about in our last webinar, should you have in place to promote telework? Who's eligible? When can they perform work? What equipment do they need? Notify them of retention and safeguarding the data. Make sure the remote workplace is safe. Are we reimbursing them for any equipment? And effectively, even for not only telework employees, but employees are generally absent, you should set up a mechanism how they can text you, they can email you, or they can call in your hours, so that, especially for hourly employees, we have their hours recorded. So beyond leaves, beyond safe and sanitary work, the third option really is telework related to individuals with COVID-19 concerns or symptoms. Now let's talk about quickly, how do we get someone back to work? When they're any of these categories of employees we talked about, either they have it, they've been exposed, or they're high risk, or they have generalized sick symptoms. So generally with all of these, especially with a pandemic, the ADA gives you more liberality to ask and force them, even though, be careful, in Minnesota, they have to consent. So be careful with the word force in Minnesota, but you can strongly encourage them to say, look, bottom line, we're not going to allow you to come back to the workplace unless and until you give us a clearance and fitness for duty in writing. Now, we know there's problems with healthcare providers providing the sufficient documentation, but conservatively, despite that administrative hiccup, though we may liberally grant an absence, we don't think you should be liberal in return to work with someone who tested positive or has been exposed or has symptoms. We generally encourage you, make sure to get that doctor clearance, especially with positive COVID clearly, and even those who have been exposed, and maybe those who just have generalized symptoms, to do your best. Don't return them to work. Make sure they've got paid leave so they don't cause too much of a challenge being forced to stay home. Make sure you have that healthcare clearance, because again, you're balancing the right of that employee to say, I can come back to work and I don't have to share you all my medical documentation, with the health and safety, as we talked about, of your employees and the public. So this is where generally during a pandemic, you can be stronger in trying to get sufficient doctor's note certifying they are fit for duty and they are clear and they're not a threat to the workplace or the public. So bottom line, feel free to quickly give us any chat questions. Generally, what should you do? First, especially going forward and planning, a lot of you in the short term have had to limp along. Let's designate who are our key players who are responsible for administering our safety. As an administration, a balance of administration, department heads, mid-level managers, and rank and file employees, and maybe the unions. Two is cobble up all this external guidance we try to give you, cobble up all the internal guidance we talked about. Let's utilize a lot of the policies, procedures, practices you already have in place, but maybe you haven't realized because we've all tried to, by fire, learn how to deal with COVID, but a lot of you have that infrastructure in place. But especially preparing for the fall and winter, we're going to have the double tsunami of not only COVID continuing, but the flu. Let's plan for the long term. Three, let's do all our assessments. Let's prepare our checklist. Who are the high-risk employees? Let's assess our work sites. Let's assess our personal protective equipment. Let's assess our safe and sanitary conditions, establish or modify your policies, procedures, practices, and notify employees. Now, on the quick legal note, a lot of you, in lieu of changing policies, which some of you as administrators, managers can't unilaterally do, that's most of you, you generally have to go to your governing body. We prefer the notices that, especially if you have a public health emergency declaration in your local entity, which most of you do, utilize notices because, again, we still question, should you be changing overall policies? Instead, put out notices to say this supplements or supersedes in the interim in the public health emergency our existing policies. So we've been working a lot more with all of you on putting out notices, and let's get back when we have some dead time to amend policies. But let's put out those short-term notices. That can be easier and less clunkier than amending your policies. Obviously, train your department heads, your mid-level managers, and your frontline responders on all these safe and sanitary issues and how to handle leaves. Monitor your compliance with all these, and of course, document, because we do feel, especially if you had an individual tested positive for COVID-19, they were in contact with others or shared workspace with others, we do feel, especially under OSHA, and we're already seeing in the private sector with class action, we are likely going to see a lot more lawsuits, even against public entities, for any employee who feel that especially, we're seeing it in workers' comp, but anyone who's been exposed by a coworker or the public, there's likely going to be an uptick of exposure, as we talked about with OSHA. So with that said, there are resources in our few minutes remaining. The Coalition of Greater Minnesota City COVID-19 website. We will be doing future webinars to address pay, to have panelists talk, to give an update on either workplace actions you can take or related to the safety issues. So keep that in mind. And the one, so I do feel that it looks like in our quick summation here, we have addressed questions, but feel free to utilize the chat button even after the webinar is done for questions. And we thank all of you today for participating in the webinar. And we would appreciate when you do close out of the webinar, or we proactively just cut off the broadcast, there will be an exit survey that pops up. So one, we'd like to hear what you thought of this presentation, but two, please tell us what you'd like to see in the future. And three, we will be making this webinar recording and all of the slides available on the CGMC website, and we will proactively send a follow-up email to all of you with Q&As from the session, and two, with a link to this PowerPoint and to the webinar itself. So again, on behalf of the CGMC and the Labor Employee Relations Committee, we thank you for participating in today's webinar, and keep your workers and your facilities safe and healthy. So thank you, everybody.